Hello, hello, hello. Good morning, everybody. Welcome back. I hope everybody is sufficiently caffeinated for our next session. So thank you so much for that introduction, Josephina. I'm delighted to introduce this session on genomics challenges with data. As was already mentioned earlier today, I think genomic challenges with data is going to be a topic that we discuss throughout the rest of the meeting. But I am very thrilled and privileged to have to be able to introduce a set of great panelists that we're going to be coming up on the stage very shortly. We're going to be having a panel discussion that's really going to be focused on solutions to these challenges. These panelists are a wonderful group of people that are members of initiatives building data generation and sharing capacity. They're improving interoperability of data sets and systems, and they're helping to coordinate partners within our local to global data ecosystem. And kind of selfishly, they also help to showcase a number of the different wonderful partnerships that we have in the PHA4GE Data Structures Working Group as well. So very excited to have them come on stage and have this discussion with everyone. But before I call them on stage, I'm going to invite Oliver Morgan back up to give us a few opening remarks on this topic. I think we already know Oliver, so he needs no further introduction. Oliver, over to you.
We just met in person for the first time. I think that's a common theme for all of us. Yeah, I'm just going to get a couple of comments. So within the IPSN, I actually chair the community practice for pathogen genomics data, and we've been on a bit of a journey trying to make a little bit of sense of this big space, and it's quite interesting, and I think things are now starting to get a bit more momentum. I think somehow we're trying to balance a very changing landscape, both scientifically, politically, but also in the funding environment. That's super challenging. So we're kind of working many dimensions all at the same time. And I think that a general sense, at least that I have, is that we definitely don't want to be trying to have single solutions or monolithic solutions or monopoly type solutions in this space. We actually need to encourage the diversity of efforts and exploration of different solutions for all aspects of data as it relates to pathogen genomics. But we need to do it in a way that's not complete chaos, and a way that helps us work together while preserving our own interests and passions, but without making it completely disarticulated. So I think Tim's going to talk a little bit about some of the work I think many of you in this room have been involved in around trying to define some attributes of data sharing platforms as one small component, let's say, of how to move the space forwards. But I think the message, I think, is clear that we need to work together, but we don't all need to do the same thing. And actually, I think there's still enough to explore that being diverse in our efforts is actually a huge advantage. So I think with just that broad framing, I'm going to hand it back to the chair and say thanks very much.
Thanks so much, Oliver. That was great. I think you hit a lot of nails on the head, and you've teed us up really nicely for the discussion that's to come. So right now, I would like to welcome to the stage our esteemed panelists. So could I please have Emma Hodcroft, Charlie Barclay, Collins Tanui, Tim Dallman, of course, and Peter Woollard. Could you please come and join me on the stage here? Great, wonderful. Okay, so just to situate ourselves, how this discussion is going to work is that we're going to start with a few introductions of all these wonderful people that you see here. I'm going to introduce them very briefly, but then they're going to have a couple of minutes to tell you a little bit more about who they are and what they do, and maybe perhaps one or two exciting new activities or initiatives that they're involved in. And then after we get to be best friends and we all know each other, then we're going to have a series of 2 rounds of questions. So I have a set of questions to ask these lovely people. Tim has a series of questions to ask these lovely people. The questions are targeted to the roles and responsibilities of the different organizations that these wonderful people are representing. But we want this to be more of a discussion. We want this to generate some saucy banter, if you will. And so if any of the panelists have any other thoughts that they'd like to chip in after, to answer any of these questions, please feel free. Once we get to the end of these 2 rounds of questions, then we're going to open it up to the floor for your questions as well. All right, we're all good. So to kick things off, we have Charlie Barclay to my left. She is an ontologist and a data standards developer extraordinaire at Simon Fraser University. She's a very key member of PHA4GE, and she is also a representative of the PHA4GE infectious disease community of practice. So Charlie, tell us a little bit more about yourself and what you do.
Thanks, Emma, and how dare you say we're not already best friends? I am insulted. Is that enough for the saucy banter to start it with? So in case you didn't know, I actually work with Emma at the Centre of Infectious Disease, Genomics and One Health at Simon Fraser University. So I am learning from the best in terms of all things data standards and data structures. So I've been working in the data standards space for close to a decade now, both across healthcare in the UK as well as biodiversity, back at Natural History Museum in London, and now in infectious disease genomics and One Health. So we've been really lucky to be a part of PHA4GE as well as GA4GH, and as Emma alluded to, at GA4GH we've just started a new community of practice, which I'm honoured to be one of the co-leads of. So we're very much in the early stages there, and I think one of the key things we're trying to focus on with that is this collaboration and how we can build more resources and tooling between GA4GH and PHA4GE so that we're not both just doing the same thing in slightly different ways. So that's something that I'm really interested in, and developing those kind of collaboration pieces with everyone. So yeah, that's me in a nutshell.
Fabulous. Thanks so much, Charlie. So next up, we have Collins Tanui. He's the Principal Technical Officer in the Pathogen Genomics program for Africa CDC, located in Addis Ababa in Ethiopia. And over to you, Collins. Tell us a little bit more about yourself.
Yes, thank you so much, Emma. I think you have said all. I'm Collins Tanui, Principal Technical Officer for Pathogen Genomics at Africa CDC. So within Africa CDC, we do coordinate a number of activities that matters related to the pathogen genomics within the continent, which runs from most of the priority diseases or the use case disease within the continent. So on top of that, I also do coordinate the Africa PGI related activities. Thank you.
Thanks so much, Collins. Next up, we have Assistant Professor Dr. Emma Hodcroft. She works at the University of Basel, and she's also a founding member of Pathoplexus. And she resides in Switzerland. So over to you, Emma, who is obviously the better of the 2 Emmas on the stage right now.
Definitely not. I think we can be Emma equal, for sure, for sure. So it's a real pleasure to be here today, both on the panel and, of course, at this conference. And I'm mostly here today, or this conference, with my Pathoplexus hat on. If you haven't heard about Pathoplexus, don't worry, you have a chance. Later today, I'll be giving a talk on it. But in a nutshell, it's a new database that's trying to make viral genome sharing easier and more equitable to enable faster and more comprehensive surveillance. And we just celebrated 1 year of launching, which is we're incredibly pleased about. And we have added a new pathogen, measles, that we're supporting. But of course, this is the beginning, not the end. So stay tuned for more pathogens and more information.
Thank you very much, Emma. Next up, we have Peter Woollard, who is a data standards curator at Emble EBI, located in Hingston, UK. Data standards are, of course, very close to my heart. So, Peter, over to you.
All right, thank you, and thank you for inviting me to this. So, my main day job is working with trying to improve the metadata that users submit. And at ENA, one of our big highlights this year is we've overhauled internally how metadata is handled, and it's now going directly to what's called the biosamples database. And that means that it's easier for others in the world to use. Coupled with that, we've now put versioning of checklists, so it means that we can update new metadata and you can change the control vocabularies underneath a lot more easily. So these are sort of, to the outside world, it's probably not major changes, but it does make things a lot more interoperable sort of now and in the future.
Awesome. Thanks so much, Peter. And last but certainly not least, my partner in crime and co-hosting this session today, Dr. Tim Dallman, who Josephina has already mentioned is a senior technical officer at IPSN in Berlin. Tim, anything else you want to add?
Thanks, Emma, and yeah, great to co-chair this panel. I think so. My role is within the IPSN Secretariat, and you've heard a lot about IPSN already. But I think one thing I would just like to mention is really the kind of values around strength and connect and innovate. And I think with this esteemed panel, I think you can see those different values that are really important in delivering sustainable pathogen genomic surveillance. So look forward to kind of getting into the discussion, hearing the different perspectives of be it data standards, be it data sharing, be it all the great work of capacity building and coordination and how they kind of fit all together. So.
Yeah, exactly. We have a great representation here of data standards developers, data standards implementers, public repositories. So hopefully we can have a very scintillating conversation this morning. All right, so that ends the introductions. Now we all know each other. I'm going to start digging into my questions. My first questions are to Charlie. So Charlie, what do you see as the key considerations for the future of pathogen data standards development?
Thanks, Emma. First off, I just wanted to note that I completely agree. It's lovely to meet all the panelists here. The imposter syndrome is high, so thank you for having me. I think we've had a common theme already just this morning of standards development is that we really need to have this collaboration and community piece and working together. And I think that extends to the One Health space. We speak about pathogens, but they're not just isolated. We've got clinical considerations, but we also need to take in that environmental consideration as well. And I think that's where standards and interoperability really need to rise to the surface to allow that sharing. I think we're all aware of the funding situation, or should I say the lack of currently. So we need to be able to get more bang for our buck. And that really is working with different partners to capture that additional information. That means that we can do more, and we can do more with each piece of data that we've got, and we can share it more widely for use in more projects. With the PHA4GE GA4GH, that's kind of what we're thinking that we'd like to start doing, is we want to start working together more rather than siloed, trying to find ways that we can compile resources, ways that we can overlap, look at interoperability between our standards, and ways that we can really grow this field so that it improves and we can do more with the data that we have.
So really kind of aligning methodologies, aligning practices, building interchange formats and these sorts of things. Wonderful, wonderful. My next question is, integrating host and pathogen data is important for understanding mechanisms of pathogenicity, how a pathogen is manifesting in different populations and communities, as well as many other things. One of the key interoperability design principles in standards development is reusing existing standards. We've been trying to review, and you sort of touched on this before, to review GA4GH standards. So these are folks that develop standards for human genomics, as opposed to PHA4GE, who develop standards for in the pathogen space. So we've been trying to assess GA4GH standards to see what's useful for pathogens and how those other standards can be reused. What do you think are the similarities, and where do you think the overlaps are between GA4GH and PHA4GE genomic standards, and what efforts are being made to bring them closer together, to align them?
I think it's that age-old trope of that everyone thinks that their stuff is really important and completely unique, and no one else is doing the same thing, and actually, it's not necessarily the case. I've definitely noticed patterns in my career across all kinds of data types and data sectors, and that's definitely the case as well with GA4GH and PHA4GE. And actually, the contextual data is where we really need to focus, and that contextual data sharing, both within the clinic and within the field. At GA4GH and PHA4GE in the community of the infectious disease community of practice that we've literally just started, so these are all ideas rather than things that are currently going on. One of the main things we're looking at is looking at the data use ontology and how we can expand that to pathogen genomics. So rather than reinventing the wheel and doing the standard thing of, oh, there's 14 standards and it doesn't meet my needs, so I'm going to make a new one, and then there's 15 standards that people don't use. We want to build on existing infrastructure and what already works in the field and has been established for GA4GH with the data use ontology. So that's one of our main targets going forward, is how we can expand that to pathogens. And I think that is something that could be really useful going forward, is rather than starting fresh, really looking at interoperability and reuse of what we've got already, working with our partners like ENA. Peter's on the panel here. We've done some work together before on the metadata experiments checklist. So being able to make sure that there's that interoperability element, and actually we've done that between ENA, PHA4GE, and GA4GH pretty well. So
yeah, and I'd say that's wider. It includes the NCBI, and there's multiple people on it, and it's helping everybody, because it means that we've worked out a core set of concepts that apply to sort of any sequencing experiment, and then we're now moving to the sort of different types of sequencing, and it's been helpful having all the different perspectives.
yeah, absolutely, and all the different domains of knowledge as well. You know, we're not all experts in everything, so it's been really useful to have those people be able to flesh out and improve those. So also so that we realize that it's embedded in real-world use cases, right? So it can actually be applied going forward.
So I think another theme that's emerging here is that in the past, standards have been developed sort of in silos, and it's really important for everybody to be on the same page, being aware of each other's activities. So thanks so much. So thank you, Charlie. That was really great. We're going to move on. My next set of questions are for Emma Hodcroft. So Emma, you've told us some exciting new developments in Pathoplexus. Can you tell us really quickly how many pathogens does Pathoplexus currently support?
So at the moment, we support 9 different viruses. When we launched, we started with 4, and we're really aiming to grow into the viruses where we saw there kind of wasn't a home. So those that people, for example, were putting on Virological or GitHub and saying, we don't want to share these in another way because we want to say, please don't publish on these, even though we're sharing them for public health. So we started originally with West Nile, CCHF, Ebola Zaire, and Ebola Sudan. And now we also support HMPV, RSV A and B, Mpox, and measles.
Wonderful, fabulous. And you're giving a talk later on this afternoon, so everyone will learn more about Pathoplexus in a bit more detail. In terms of streamlining data structures from sample collection through analysis and ultimately to the stage of data sharing, aligning all of those data structures helps to increase efficiency and reduce barriers to sharing. Pathoplexus is using PHAGE's ontology-based standards in its metadata requirements. Why did the Pathoplexus team feel that it was important to implement these standards or these data structures as opposed to structures perhaps used by other repositories?
I mean, I think that this feeds off of what Charlie said really well already. There's no need to come up with yet another way of doing things or trying to kind of expand things that maybe aren't fit for purpose. We were really lucky because so much work had already gone into developing the PHAGE standards, particularly during SARS-CoV-2, that not only meant that they were incredibly well thought out and that the community had already had input, but it also means that today, when, for example, at the workshop on Saturday, which some of you were at, when we're asked about how does our metadata work, and we say, well, it's based on the PHAGE standards, perhaps you know them from SARS-CoV-2, a lot of people know them from SARS-CoV-2, so it makes that barrier lower. It means that people have an idea of what to expect, many people are used to them, and of course we adjust them a little bit from virus to virus, but it means that people are able to pick it up and move with it quicker, and that improves data sharing.
Right, right. And if people are already using PHAGE standards as part of their data collection and storage, they don't have to do a lot of reformatting when it's time to submit. So that's great. My last question is, what were the lessons learned from the pandemic and perhaps other public health situations that shaped Pathoplexus's data sharing principles? This may be a little bit of a spicy meatball.
So yeah, I mean, this is definitely a question where I could talk for an hour about this, but I will resist. I think one of the most important points that I'd like to make, though, is that I think sometimes when we start talking about data sharing, we focus on the fact that it can be hard and that not everybody wants to do it. But I think there is really no better example than the pandemic that showed that when the conditions are right, when the incentives are right, and when the environment is right, people actually do want to share data. So I think it's really important not to start from an assumption that, well, we can't get everyone on board, so let's not even try. It's more, how can we create an environment so that people feel empowered to share? How can we set up the right incentives? How can we make people feel protected? How can we make people feel part of an ecosystem so that when they put data in, they feel like it's something that they're getting something out of as well? On top of this, of course, just in general, I think the pandemic showed us what we can do when data is sharing. I come from viral phylogenetics and viral evolution, and so for years we've been saying and showing in a few smaller cases, this is what we can do when data is shared quickly. And in the pandemic, we really had an opportunity to show we can detect variants, new mutations, we can give predictions about what impacts might be. And I think that that sets a stage for, imagine what we could do if we can create environments where that data sharing is not just for a few viruses, but is happening more often with more people. And I think the bottom line is we could have this again, that sense of community, the scientific gains, the public health intervention gains, when we can create an environment where data sharing is easier, where people feel protected, but where it's still open to benefit everyone.
So really, it's all about, and then we've talked about this before, building trust and kind of following the community's lead, right?
Absolutely.
Yeah.
I think one thing that we really take to heart in Pathoplexus is that we are not there to be data owners or data holders. We are there to just be a facilitator for the community's resources, which is their data.
Right. Excellent. Awesome. Thank you very much. My next set of questions are for Peter. So Peter, ENA will soon be implementing phage standards for wastewater surveillance in a brand new biosample package. Can you describe that process to a little bit? Who's involved? How it happens?
Okay. First of all, it's taken a lot longer than we expected. Because from the outside, it looks very easy.
Right.
But what we try to do is align it with sort of the existing standards, which is a theme we've had before. So at ENA and NCBI and DNA Data easy for me to say, they all use the Genome Standards Consortium MIXS standard wherever possible. So there were various concepts that were already in that. So those we had to really try and map to the phage ones, but then there's unique concepts that are coming from phage, so that's what we sort of combine those.
Mm-hmm.
And we're also trying to think how to make it more sustainable and future-proof.
Right. And when you're implementing a new biosample package, is that very disruptive to the system?
No.
Okay, great. That was easily answered. I have another question for you. So the INSDC has just published a new governance framework for adding new nodes. What are the goals of adding new nodes, and what are the, or if any, anticipated pain points?
Right. The goal really is to get the whole world and many diverse communities sort of involved with INSDC and owning some of the work that's going on, so that the whole, because we're all human, right? And we've got a whole planet, and no one country or institute knows everything, has been discussed a few times. So by spreading nodes around the world, you get very different perspectives and you benefit from all this different knowledge. In terms of pain points, there are some difficulties. That INSDC has been going for 40 years,
right.
And it's evolved, and a lot of the things have been sort of handshakes.
Right.
So there's been a series of work over the last few years has been documenting exactly what the internal standards are and how you can share data. And so this was going to be one of the pain points. It'd be very hard for another organization to come in and go, what's happening? Because they've not got that build up. But so to make that easier, we've got those minimal specs, and a new member organization would partner with an existing INSDC node, and that would help them build up through what was needed.
Okay.
And there's two levels. There's an associate level, which is an easier way in, because you'd still have to conform to the standards, but the data you actually hold would be a limited set of the sequences. So it could just be the viral set or bacterial or whatever, or just that your country's data.
Right. So it does sound like there's a lot of flexibility if someone wanted to be a new node.
Yes.
Yeah, okay, wonderful, great. Awesome. Okay, so my last set of questions are for Collins, obviously. Last but very much not least. So Collins, recently PHA4GE and Africa CDC co-hosted a meeting in Uganda in order to spearhead the development of a new malaria data standard for public health research and malaria control programs. And while I was there, I found it was very interesting. Some very interesting points came out of that discussion. And one was the importance of WHO guidance around methods and data capture. And the other was around the roles of academic data providers and control programs as consumers of results. So my first question to you is, if PHA4GE and Africa CDC co-develop a malaria standard, how successful do you think the uptake will be unless the WHO is brought into the conversation? Spicy.
Thank you so much, Emma. I think that's a very important question that and very critical one. That WHO guidance is critical, especially in the ensuring global alignment with this document. So the development of this metadata standard, especially for the malaria, together with the other priority pathogens, including cholera, with PHA4GE, is very important. First, we know alignment of these metadata standards is important, especially for within the national context, at the same time with the global context, to ensure that there is harmonization of all this data. So together with Africa CDC, PHA4GE, involving WHO and other relevant bodies early enough will ensure that there is ensure success in terms of uptake and harmonization of this metadata. And also it will ensure that it is incorporated within the existing frameworks.
Right.
Global framework, at the same time to the national level documents that these countries are developing. Yeah.
Fantastic. So getting the right partners involved early is, I think, key to this. And a good thing we have a representative of the WHO on the SARA IPSN here. We'll pick Tim's brain in a little bit about the same issue. My next question is that the standards that PHA4GE usually develops are for primary data. So you have a sequence record and you have metadata attached to that, and there are standards developed for that metadata. But in our conversations in Uganda, it seemed that aggregated data, standards for aggregated data, might be almost a little bit more important for presenting malaria data to different stakeholders. What do you think about standards for aggregated or analytical results to support actionable data sharing in Africa? Do you feel like those would be more important to look at rather than, say, primary data standards?
Yeah, so Africa CDC have been advocating for that collaborative effort, or the regional collaborative efforts. And as much as the PHA4GE are majorly focusing on the primary data standards, Africa CDC sees this one as a value, especially in developing standard for aggregated and data analysis. So we have done this, giving an example for the cholera, and also this one, the one that we are doing on now for malaria. We want to follow suit, whereby we capture data from from when the sample is being collected, then taken to the lab, and all the way to the data analysis. So ensuring that we capture the variables at all stages will make a meaningful impact in terms of when we are analyzing this. And then the other part is regional, whereby the national public health are generating data So is it harmonized? And if it is harmonized, when these regional bodies or regional national or regional collaboration comes in, we want to make meaningful information out of this that can inform local decision that contribute to the global decision. So, and Africa CDC is for a collaborative approach in all aspects of data analysis.
Okay, so what I'm hearing is both types are probably important, harmonizing data at the sequence level, but then also having other sets of standards that can link that primary data into trends, and having standards for reporting that to stakeholders. Having all of those things are important parts.
Yes,
Right.
so as much as we have got that data, let's say for example from surveillance, there is a need to link all this data from the surveillance to lab and all the way linking the bioinformatics. I'm seeing in a way that if we don't do this, we might end up having the siloed bioinformatics or genomic data, you know, whereby the data or from the bioinformatics is hanging from somewhere, but you cannot make insightful information out of this. So linking all this data makes sense to ensure that we have good informed decision.
Fantastic.
Yeah.
Great. Thank you so much. Now, Tim, I know you're helping facilitate this discussion, but I actually do have a few cheeky questions for you. So coming back to this idea of the WHO as an authoritative source, you can help promote the use of data standards for enabling data interoperability. How can we be earning the support of the WHO in encouraging the uptake of PHA4GE Africa CDC standards?
Thanks, Emma. I mean, I think one of the things we can talk about is the role of IPSN as this kind of intermediary network, you know, which represents you as partners and members. I was secretary, I was hosted within WHO, and really the mission of IPSN is, you know, is to connect and amplify, you know, the work of the partners and really, you know, help the implementation of that work, be that, you know, connecting with countries, connecting with regions, disease networks, you know, enabling us to think in a modular way about all of the great work that's happened in all of the, you know, distant and vibrant parts of the pathogen genomics community. And if that, you know, ends up, you know, being a normative product produced by WHO, because that's the most appropriate way for that product to, you know, have impact, then, you know, certainly, you know, it's great that IPSN can kind of facilitate, you know, that process and that pathway. And I think we've seen a few examples, you know, coming out because of that. I think the other role that WHO and IPSN can help in this process is really this convening power of, you know, bringing different parts of the community together to think about common problems. I think one of the good examples of that was in the, you know, the MPOX, Public Health Emergency of International Concern, where, you know, there was an ask for a convening of technical experts to discuss, you know, the challenges around, you know, genomic implementation, but really make it focused, you know, within the country response. You know, there was lots of, you know, great work and great guidance coming out of different academic and regional partners. PHA4GE, for example, you know, we had brilliantly this morning Placide talking about the different evolutions of this pandemic. So lots of great work was done in 2022 of the global pandemic, and then lots of great work done in DRC in the current response. So bringing those different partners together, thinking what it would be useful, consolidated guidance that we can agree on as a community that's useful for countries to implement genomic surveillance. I was really proud of that work, and it was great that Eddie Lissamaki chaired the technical working groups as we founded on, you know, the response of where it needs to be. I think one of the other things I'd like to mention is, I think where IPSN and WHO can maybe help with some of these things is, you know, help articulate the community's kind of principles and attributes of how they want the ecosystem to represent, you know, all members of them, you know. So I think one of the examples of that is work around the principles and attributes of data sharing platforms, where, you know, I think in the community, long discussions, and I think the community holds itself up to principles and ideals that are built on mutual trust and friendships and collaboration. And I think we can help distill those down into something that we can be shared and be advocated for to get the systems that you run. So that's kind of how I see IPSN's interface role there.
Right, and again, I think you're reiterating the importance of interweaving all of our different efforts, getting consultation from all of us as different stakeholders. That helps to align all of our efforts and help promote each other's work as well. Okay, so that brings us to the conclusion of my questions. So now I'm going to hand the conch over to Tim, who's going to take over grilling our fine panelists here. Over to you, Tim.
Yeah, and yourself, Emma. So you're not gonna escape either. So I think Josefina Campos mentioned this morning this idea of constructing a shared vision for strengthening genomic surveillance over kind of a short-term goal, and connected data ecosystems was like a central pillar behind that. And obviously you can unpick that in lots of different ways, but comparability of data and interoperability, right, are cornerstones of that vision. So this one's to you, Charlie. So from your perspective, what are the most critical gaps in the data standards space that need to be addressed to enable this coordinated data ecosystem and global comparability?
Really nice, easy question to start me off with there, Tim. Thank you very much. I think this is a really complex and multifaceted question, and I think something that's coming up today as a theme, clearly, is that collaboration and communication piece. So I think trying to build those networks, and I know that Josefina mentioned the importance of networking earlier, in order to be able to translate these ideas and work together and ensure that it meets all use cases. But then I think the other side of things is that implementation piece, and how do we encourage uptake in the community? How do we make it easier and remove that barrier for uptake? I mean, Emma spoke earlier about, having standards for Pathoplexus means that if you're capturing it one way, there's less transformation that needs to be done, so you're already removing that barrier, and I think that's something that's really important in assessing those challenges and helping to deal with those challenges. The other thing is not everyone, as much as they would love to spend time on data standards, has the resources or the capacity to. So ensuring that there's additional incentives where possible to be able to encourage use and make sure that we have enough representatives from everyone and across the globe to do that. And not just globally in the pathogen space, but I know I'm harking on, and I said this earlier, but from other domains, so from the environmental sector, and I know that Peter's working on some stuff with eDNA and hDNA as well, so I know that could be an interesting piece in terms of trying to make sure that we're not siloing ourselves. We've got to think about making sure that we're applying it to the necessary use cases, but enabling that flexibility and that modularity that you alluded to earlier to ensure that we can adapt as necessary, because goodness knows the pathogens are adapting fast, so we need to keep up in the data standards space too.
Thanks, Charlie. So I think, this kind of concept of reuse and iterate to kind of move the field forward. And I guess when you were speaking earlier, it kind of, the people who use your standards are not one community of people, right? The same standards might be used by groups of different communities differently. So getting into that mindset of, what does the consumer of these things, how are they going to interact with it?
Was it we had reduce, reuse, recycle in the UK? It was a very catchy slogan. I think that's exactly it. We started with the phage SARS-CoV-2, and we've built additional modules onto that as we've gone on, and I know Emma will allude to that later in her talk, as will I, and it is that idea of we've got something that works, that's fit for purpose, that is already being engaged. Now how can we keep that at its core and improve upon it to make sure that we're supporting its uptake?
And I'm just going to carry on just for one little more. So I think when I speak to the data standards community is what is going to be the impact of some of the AI and analytical methods on supporting that data transformation. Can you do you see that as an opportunity to do some of these gaps? Or?
Absolutely, I see it as an opportunity, but I also think it's something that we should be cautious with. And you are speaking mine in Emma's language, because this ties into ontologies, which, as some of you may know, that a lot of our standards are ontology-based. The idea is this makes them machine-readable as well as human-readable, and we have clear definitions, labels, and relationships defined between the objects, which is of real importance. Now, with ontologies, it gives us the opportunity to design these classes, these objects, in a way that is machines and AI in particular can make those inferences, and that those sort of the complex querying that we wouldn't be able to do otherwise. But it's really important that we, as the domain experts, define those ontologies, those terms and classes, and those relationships first before we just throw it over to AI. I think that's something we need to be clear in. And I know Peter's sitting there giggling because I've been saying this to him for years.
Do you want to come in, Peter?
Okay, yeah, because the problem with AI is it does everything very confidently. So it can be confidently wrong as well. Most of the time it's right, but it's confidently wrong sometimes.
Yeah, I just wanted to kind of say a similar thing. Garbage in is garbage out, right? So, but also I think there's opportunities to be using things like LLMs to help automate and reduce the burden of curation, right? So getting data from their kind of native formats in different information lab management systems and spreadsheets, getting those into a standardized format, that can take a lot of effort. It can take a lot of time, money, resources, and if we can be reducing that with these types of tools, I think that would be very helpful in getting everyone, increasing uptake of standards in their implementation.
Not to plug Sigma or anything, but if you can integrate that with tooling, such as a spreadsheet-style validator, the data harmonizer, that would be really helpful to make it easier.
No one said we couldn't do cheeky plugs.
No, it's great. And I think it's really exciting to see how this field kind of moves in the next year or so. So moving on over to Emma. So we've talked about this trusted and connected global sharing model that is critical for having equitable and active participation in genomic surveillance. So kind of from your experience and from Pathoplexus perspectives, how do we balance this kind of sovereign ownership of genomic data with the need for rapid international sharing, especially in emergencies?
I think this is absolutely critical, because if people feel like when they share their data that they're giving it away, then that is not a very attractive proposition to make to people. And so I think it's really important that people still feel and that they have sovereignty over that data. So for example, when you submit data to Pathoplexus, you don't give up any of your rights. So the data is still completely yours. You are just sharing it with others through us. And one of the things that we've done to try and help people feel more protected, if that's something that they're looking for, is that we offer sharing in two ways. So you can choose to share that data openly, which is essentially the equivalent of sharing it to INSDC. In fact, we pass it on to INSDC via ENA, or we offer what's called restricted use data, which means that you can share that data for public health use, for example, but other people cannot publish or preprint on your data without your explicit permission. This can last for up to a year, and it means that people have a chance to be the first person to publish on their data, which of course is completely reasonable, while still being able to share data quickly, especially in outbreak and epidemic scenarios where getting that data out there can make a huge difference in understanding, in developing new treatments, monoclonals, vaccines, understanding spread, all of these things. So it is about finding balance, of course, because there are in different incentives pulling in different directions, but I think that also we can find ways to help people feel, it's really about empowerment, about empowering them to feel that they can share while not feeling that that means that they're giving away.
Thanks, Emma. And I think it's really, as you say, being a system that can tackle the diversity of perceptions of around the data sharing practices for different people. So one of the other things about Pathoplexus I find interesting, is the attribution. So often, sequence data is either, if it's reused, how do you attribute within the publication? So this concept of digitizing that with DOIs. Can you speak a little bit about kind of that?
Yes, of course. So one of the things that we are still working on that's partially there, but that we hope to make even better, is allowing people to get more credit for just sharing sequences. Because you don't have to publish on sequences yourself for them to still potentially be incredibly valuable to the community at large. But unfortunately, of course, in science and academia, if it's not published, it kind of just doesn't count. And that is not true to reflect the impact that sharing data can have. So we have a concept within Pathoplexus called seq sets. So for example, if you're publishing a paper, you can put all the sequences that you have used into a seq set, and then you can generate a DOI for that seq set that you can use in your publication. So we already have a way of kind of allowing people to see very specifically exactly the sequences you used. The next step that we're currently working on is then tracking that DOI back to the original sequence. So for example, you're a submitter, you can look at a sequence that you uploaded and see, and let's say that it's open, so it's okay for other people to publish on. You could say this has been used in 2 papers on this outbreak, in 4 papers on data standards, and actually in a new Arctic primer scheme. That would be an incredible thing to be able to take back to your funders, to your institute, to show I am making an impact by data sharing, and it allows you to claim that credit, which you deserve, for both generating that data and for putting it out there for others to use. So this is something that we're really excited to implement because it really changes the game as far as allowing people to get credit for just the act of generating and sharing data.
Yeah, I think that's a great gap to fill. Over to Collins. So I think we've heard today with the keynote, Africa has been very impressive in leveraging all of the investments in genomic surveillance to tackle emerging threats on the continent, Mpox, Ebola, Marburg, the list, cholera, the list goes on. And I think, grounded on data and analytical sovereignty, so, data generated and analyzed and, for local impact. So can we just talk a little bit more about this kind of concept, really? So, what is Africa CDC's vision in ensuring that genomic data generated on the continent serves both that local public health need, but also, supports the global surveillance efforts?
Yes, thank you so much, team. Data equity and access is a central mandate for the Africa CDC. And we have been focusing on assisting the member states in generating this data, analyzing, and also sharing this high quality genome or data, not only for the regional priorities, but also contributing to the global surveillance. Key to this is ensuring that they receive the necessary reagents that can enable them generate this data. At the same time, there is building capacity. And this, we majorly focus on end-to-end approach ecosystem to ensure that they are able to generate this data from when they collect, they are being transported to the lab and then sequenced. And these need capacity to be built for them to generate this. And the other thing is on the development of the strategy framework, that do we have a system whereby it can be integrated within the national public health? So these are the strategic document that we support these countries to ensure that there should be sustainability, in cooperating within the national public health. So far, a number of countries have generated a genomic strategic document that incorporate all the genomic surveillance within the national public health. The other thing is on the collaborative approach, whereby once we generate this data, do we have exchange of knowledge, There's that exchange of knowledge through the collaboration between these countries. And once we have got this one, the data help within the national public health for the local decision making, outbreak response, and also further development of relevant policy documents. And then there's also the aspect of Agari. We are currently developing Agari, which is being led by Prof. Alan. And this is important tool for ensuring that there is easy access to this data and sharing of the data. So, and this one will include the metadata that accompanies all this data that can be widely being used by the member states. Yeah, thank you.
Yeah, thanks, Collins. And I think this kind of institutionalization of pathogen genomics into national public health action plans is a critical pillar for sustainability. And one of the things Josefina again mentioned this morning. So moving to Peter, I think we're kind of hearing, and I think Oliver mentioned, a diverse ecosystem is emerging. We're having more and more countries generating capacity, more and more countries thinking about that data, how to the standards behind it, how to connect it, how to store it. EBI, ENA, INSDC have been around, as you said, for many, many years. And so I think one of the things I'd be really interested to hear is how kind of ENA and INSDC kind of see this kind of evolving diversity of ways of exchanging and integrating data.
Well, we have to be realistic and pragmatic. We'd prefer that if people put the sequence data and the metadata into one of the INSDC repositories, but we are in the real world. And as Emma eloquently described, there's reasons why people can't immediately put data in. But where they can, it's great because it's then open to the world. And it's also there in a sustainable way so that in 10 years' time, 20 years' time, it's still there for people to do research on. But there is limits to any single resource. So it's fantastic there is this ecosystem. And as people talk now and earlier, there are lots of systems out there where people can do particular queries. They can integrate their own epidemiological and clinical data together in different ways that we don't have. So people need to be able to take data out and analyze it alongside their other data.
Yeah, I think that's a great acknowledgement of this diversity. I think so. Agari, Pathoplexus, ENA, they will all hopefully coexist for different functions and for different communities. How are these things going to be interoperable and connected going forward? What's the vision there? And that's to anyone who wants to go.
Some of it is, as we described earlier, with trying to use the same interoperable metadata. So we've got the PHA4GE, where we're using most of the PHA4GE things, but we're also using some of the Genomic Standards Consortium standards, so that it means that data can be you can find the data and you can interoperate. It's interoperable. The other thing is to be really clear about when data can be made available and open, and it doesn't just stay on hard disks forever.
Yeah, there's definitely a challenge of discoverability, right, as well as, findability.
Yeah, and I can follow up on that from the Pathoplexus perspective. I mean, certainly we benefit a lot from working as part of an ecosystem, from talking to PHA4GE about data standards, to the PHA4GE community about what does data sharing mean to you? What are your barriers? What would you like to see? And we work a lot with ENA. We've had many phone calls to discuss how can we make the kind of handover of our data to ENA more easily, and how can we pull that data down and make sure that it's available, while of course always being attributed back to ENA or NCBI. But also it's about being part of a larger ecosystem, because as you say, people want to do different things with data. They want to integrate it in different ways. They want to analyze it in different ways. So from Pathoplexus, one of the things that we've built in is a really strong and open API so that people can build on top of that. We don't want to be something that's kind of walled in, where you can't access that data, you can't analyze that data, because data is there to be analyzed. And so we have ways that people can query data and build, for example, web applications that might help, as we saw in the pandemic, track variants or new mutations. And for us, this is really critical because people have different data analysis needs. And so making sure that we can link those up in ways that everyone agrees are helpful is absolutely critical to make sure that everyone can get from that data what they need.
Yeah, I think just to jump on that point, I think that's a really important point to make. And I think I love what you're doing with Pathoplexus, the way you're giving the options of the data sharing, so I think that's incredible. And I think that's something that we often think of data sharing and data standards as being you have to give everything and you lose everything. And actually, having high quality structured data, particularly contextual data, means that you have the option and the facility to share what you want and restrict what you don't. And I think that's something that we've definitely been trying to educate and let people know about, is that utilizing data standards doesn't mean that you have to share everything. And actually, we talk a lot about FAIR principles when we're talking about data sharing, but it's also important to remember CARE too. And by having good data structures and good data standards, we can ensure that we have that collective benefit and that authority to control. And that's a really important step when we're considering this on a global level.
Thanks. And maybe I can ask a question to Emma to kind of finish before I open it up to you guys. So I think, it's kind of clear that networks and coordination are kind of a key cornerstone of this data ecosystem. So Emma, from kind of your experience, how do you think organizations that are represented here on the panel and many other networks and organizations in the audience, how can we work better together in setting some of these global norms, but being mindful of the national and regional needs?
Right. So, I think we've kind of touched on it. Having forums like this, where we can be discussing what are the priorities of each of our different organizations is really key. I think we've kind of also mentioned that the sort of connective thread between all of our organizations, at least from my perspective, is that idea of building interoperability. Right? There's never going to be one standard to rule them all. There's never going to be one platform to rule them all. The key is strengthening that ecosystem with that interoperability. The other question is building consensus around norms. So what are the criteria for those norms? What do those norms look like? And each of our different organizations are going to have different perspectives on that. So again, coordinating, bringing us together, discussing what those norms might look like is really key. I think, as you already mentioned, Tim, I think we all of our different organizations, plus those ones that you were alluding to that aren't on this stage, we all have our different strengths, and we all have different but overlapping networks and reach, right? And I think that together we can be doing things like advocating for the use of standards, advocating for funding, for implementing and maintaining standards over time, for making sure people are trained, and there are toolkits for building standards and also for using them, that there are people that there are personnel, dedicated personnel for curation and standards development, and that standards are integrated into experimental design. I also think that each of our different organizations may be able to play different roles and have different responsibilities in developing these norms and building consensus. So off the top of my head, so to speak, PHA4GE, I think, has some real strengths in building data standards development methodology and perhaps building specific standards and tooling for their implementation. Whereas IPSN, it would be wonderful if they could build toolkits around that methodology to sort of create consensus around how standards, what are good best practices for how standards can be built, and helping to make those standards more accessible and findable. You were just mentioning that. And one of the initiatives, I can't remember if you mentioned it already, is building the PHA4GE IPSN Data Standards Registry, and I think that was on one of Josephina's earlier slides. So enabling the community and all your different data standards development initiatives, that this catalog or this registry will be a place where people can submit their data standards, and that will make them easier to find and easier to reuse. In terms of Africa CDC, these are key stakeholders in all of these different processes, really grounding all of our activities in local data needs and how that data needs to move around. Absolutely critical. And GA4GH, they're making standards for human genomics, and that's the other half of this whole equation, right? And so, staying on each other's radars, talking about what norms should be, what should the best practices be, and joining forces in coordinated messaging, I think is really, really key.
Okay, thanks, Emma. So I'd now like to open it up to the audience for Q&A. So if you'd like to be, please raise your hand, and we'll try and see you with the light shining on our faces. But yeah, please introduce yourself and then specify if there's a specific panelist you want to direct your question for, and please wait for a microphone.
See a few hands.
Thank you for a very engaging discussion. So, sorry, Peter van Hersden. I only know about a third of the people in the room, so I guess for the other two-thirds, I'm Peter van Hersden from Sanby. The first thing I thought about when you guys were talking about the fact that we need to get everybody together is that I cannot handle that many extra Zoom calls.
Yeah.
And I worry a little bit about the funding. I hear you 100%, Emma, and I'm not sure whether Emma or Emma Griffiths or Tim needs to handle this question, but one of the things that worries me is it's been historically extraordinarily difficult to fund curation work and data standards generation work, and the emergence of AI as a funding priority for funders makes this even worse, okay? But we have a lot of already underserved users, and there's a huge gap between us, who I fear are too abstract for most users, and those people who, as you said, are using the standards. So then we've got PABs. Is it not possible to, or what model can we think about to support the different networks that need to exist on tuberculosis, rotaviruses, whatever, and then somehow also support the overall coordinating activities? Because my experience is that the funders are not interested in long-term support of the PHA4GE because they don't see its application, and then the users are too busy with their applications to actually be part of the many, many Zoom calls. So can we find a way to kind of work between these things, both to empower and then to fund?
Maybe I can start, and then I think data standards, and I think it's, from Charlie's point, for data quality, having data standards around how you describe your data in all of its different dimensions are critical. And I think, we're probably missing an advocacy message around that, where we're trying to build so much in-country capacity, and it's a critical component that continually needs strengthening. So I think you're completely right there, Peter. And I think when we think about funding streams that might come out of benefit sharing agreements, articulating strengthening capacity as being a critical part that needs to underpin the global surveillance. There's no point having a beautiful PAB sharing data system if it's not founded on strong sustainable capacity, and data standards are a really important part of that. So I think there's an advocacy piece for sure.
I mean, I think there's a top-down and a bottom-up approach that needs to happen here, right? I mean, similar to when funders started requiring data sharing as part of the mechanisms for distributing funds. I mean, did that make all the data get shared? No. But did it help push it forward? Yes. And I think, funders have a role in requiring the use of data standards and ensuring that data is properly curated to make sure that that data is sustainable and it has longevity. And what I mean by that is that it's of sufficient quality that it can be used for other applications, right? It's understandable by the different parties that need to use that data. I think that building standards into experimental designs when we're writing our grants, that's critical in terms of like this bottom-up approach. Setting the norms that, you don't curate your data at 5 to 5 on a Friday. Like, the data is a second-class citizen. That it's just, your contextual data is just as important as your sequence data. That's something that we all need to be working on. So, I think that we're gonna need a multi-pronged approach. And in terms of convincing funders, I mean, we discussed this at GMI 13, right? And how there's a trend in funding where funders are always chasing innovation rather than supporting things that already work, right? And I think we need to be kind of talking more about that. And because, funding is supposed to be supporting the community, and if the community needs money for these things, we need to be pressing for that. So I think capturing success stories, and horror stories showing what we couldn't do with messy data and in the absence of standards versus what we could do when we had standards and we had good quality data. I think that's another key part as well. Anyway, I'll stop there.
I was going to say something that I thought was interesting in the phage wastewater specification when we were designing that as well on the funding aspect was the inclusion of the sub-grant testing. So not just money going towards the people that are developing the data standard, but giving it to the testers who are going to be seeing if it's feasible and actually applicable in practice. And if that's something we can all start including in our grant writing, that is a really positive impact for those communities that otherwise wouldn't necessarily get the benefit and instead would get the burden at the testing stage at least.
And actually, it was through that mechanism that we had new implementers, right? We were able to write case studies showing how people didn't know about the standards before, but via those incentivization programs, they learned about the standards and they were like, oh, wow, this actually works. And now we're going to actually implement it in our initiatives and in our routine practices. So yeah, little pots of money can be very powerful for changing practices.
Just as a back and forth between me and Emma, I promise I'm going to shut up after this. To your other point, Peter, on trying to get money in with AI and all of that coming in, I think put standards and ontologies in the AI applications. We all know that AI can't do everything that it's saying it can do yet. So add that in, use the sexiness of AI to dress up the slightly unsexiness of data standards. Emma, you always say that. So I think, putting that in, if you want to use AI and you want to maximize its utility and LLMs, making sure that you're encouraging that data curation piece and accounting for that and costing for that when you apply for your grants.
If I can add one last thing, I just want to also push back against the idea that innovation happens in a vacuum. Innovation does not happen in a field with a stick and a rock. It builds awesome new things of what is already existing. Uber didn't invent cars or highways or the highway code. It found new ways of using that. So we need a solid base. We need to know what we have and how to find it before we can make innovation.
Hello. I'm Alfredo Mayor, working on malaria genomics in Mozambique. Mass media is now a big consumer of data and insights derived from data. What opportunities do you think are there to promote, to stimulate a more balanced sharing of information? To anyone.
So thank you so much for your question. If I got it correctly, getting this data being shared first, I could say that the first thing is ensuring that it is the metadata is standardized, and then once this metadata is standardized, there is a collaborative space whereby you bring all these people to come together. That's the first step of ensuring that they share the data. So if you have got a number of countries, let's say 10 countries, the first step, if you bring them together, that is the first step of ensuring that there is data being shared first among those people. And then knowing the importance of contribution to the global picture. Then using a platform, let's say, for example, like Agari. Agari, we have got the Terra, that the people have been using the space whereby they can collaborate within that space without losing their data. So I think that is one of the things that I see that it could be the best approach. We have seen that in other priority pathogens. For instance, we have the cholera, whereby they have shared the data through open access platform. We have shared this data through the Agari, for instance, and they came together and they analyzed this data together. So I think that is one way of ensuring that they locally first share this data, and then once they have analyzed and get insight locally, then it can be contributed to the global surveillance.
And have you seen that that's really driven change by being able to support that process that you just described?
Yes, it's working because recently we had mpox being analyzed, that the around 23 AU member states shared the data through Terra platform, for instance. They came together and they analyzed this data. Secondly, we had the one for the cholera, where for the first time that they did generate data locally, they shared the data, they came together and analyzed this data together. So indicating that there is high chance, there is urge or appetite to ensure that this data is being shared. It's not that they want to for their own, but for the whole continent and the global arena.
So I think you're highlighting something here, that there's different kinds of sharing when we're talking about sharing, right? There's public sharing, and I think that's kind of what we all think of when we think of sharing, but there's also sharing in trusted networks and with trusted partners, and that is extremely important in the data ecosystem as well. Not everything needs to be shared publicly. Anyway, that's it.
And the other aspect, an obvious one, is that you've got to really build the infrastructure ready. So the servers are there, the submission forms, things are there, the data standards have been done, the trust is established, so that when horrible outbreaks happen, people are ready to sort of push that data into whatever system, and then it's more likely to be then accessible fast.
Great point. And any more questions from the audience?
Thank you. Hi. Nicola Holden from SRUC in the UK. So I've got a question for the panel, which is a little bit maybe more horizon scanning. So what do you think, and have you considered how to implement data standards, for example, around microbiome data sets? So we're talking very much in the kind of research arena at the moment, where researchers might go out, not necessarily looking for pathogens, but there might be pathogen data within that data set. So how do you sort of plan, Peter, maybe you've touched on eDNA, how do you plan to sort of pick this up and then implement it with the same sorts of data standards as we need?
Okay, so in ENA, we get all kinds of sequencing data, including there's a huge amount from microbiomes, from terrestrial and freshwater and marine. And it sort of goes into the ENA system, and then there's other partners, particularly Magnify, that's another group at the EBI, and they systematically pick up data sets and run them through pipelines and identify which taxonomic groups are being found. And we all try to conform to the sort of, again, the same standards of using the GSC MixS. So that information is there, ready for others to use. And there's some of the metadata of things like the latitude and longitude and collection date. Sounds very basic, but that can then get correlated with when pathogens have been found.
Yeah, I was just going to jump on that as well and say, with PHA4GE particularly, we're actually starting to move into that space with the wastewater contextual data that we delivered. And actually at SIGO, that sort of led into as well looking at soil microbiome as well. So as Peter alluded to, although we think it's quite different, you know, your collection method, your collection device, whether you're capturing sort of a composite sample or a clinical sample, you're still capturing that information. You're still capturing your sequencing instruments, your bioinformatics and your QC. Whether your pipelines are for one reason or another or a different purpose, the fact that you need to capture them and the version of your pipelines for that reuse and interoperability is the same. So we can actually still build on a lot of those frameworks and those standards that we've already got, but add on these sort of additional layers of complexity as the technology evolves and as we start to do more of this microbiome work. And actually, something that we've been doing with the wastewater specification is it's now informing the development of a new platform in Canada, which is called iMicroSeq, which is building on an initial portal which was based on virus data, specifically for COVID-19 is how it came about, and now it's been expanded for water microbial genomics in general. So actually we are still trying to integrate these data standards into these kind of questions as well.
And I would just also add that the first important step in building a data standard is scoping needs. So when we were scoping out needs for the wastewater surveillance data standard, people were telling us they're doing metagenomics, they're doing culture and whole genome sequencing, they're doing amplicon sequencing, and all of these methodological approaches need to be baked in to the data standard. So the way you're describing, like you just said, the way you're describing the sample could be the same way, regardless of the different sequencing approach that you're using. But when you get to the sequencing module, you're using different fields, and in the bioinformatics module, you're capturing those different methodological differences, using different fields and terms in those different modules. So, yeah.
Thanks. Any other questions?
Thank you very much. I'm Taranten from PHA4GE in Switzerland, and yeah, thanks very much for this interesting discussion. I'd like to ask a very high-level question. So, because we're talking about all the international problems, I was wondering, are there certain things that local countries can do, or the best things you could do? Or asked differently, if I happen to meet a policymaker from my own country, is there anything I could ask them to support, yeah, the discussion here and your efforts?
I mean, you could ask them to support good quality data, right? I mean, that's return on investment. I mean, I think that's probably one of the most compelling things, is having a business case for not just sequencing and genomics, but also for how to make good quality data so that you can reuse it to answer different types of public health questions. If you have data that only a certain people can understand because you made a spreadsheet and only they can understand what it means, then that data, you're not going to get that return on investment. So setting yourself up for success by advocating for good data quality management systems, not just for the sequence data, but also for the contextual data, implementing standards is a really cheap and easy way of doing that.
I guess also I think it is worth talking about ensuring that you have privacy laws in your country that enable data sharing. So we ran into this in the pandemic. Some of you might remember that there were countries that were sharing, SARS-CoV-2 sequences really nicely, super well, and then they had to stop because there was a question of, oh, is this covered by human privacy laws, or can you share a virus? And of course, that's not really a yes or no question, because it also is going to depend on, is this a virus with stigma? Is it a sexually transmitted disease? It's not so simple. But of course, in an outbreak, you don't really want to be having debates in your parliament about how our laws work. You should work on that in peacetime, as we call it, so that you understand what's okay to share. How much metadata are we going to share? How does that fit into our country laws? And how can we make sure that our hospitals, our clinicians, our researchers, and our public health understand what that means for them? Because that's another fear, of course. If I work in a hospital and I take a sample and sequence it, if I feel like I don't know if I'm allowed to share it, I'm not going to share it. And so if I'm confused about what the laws are, that can also be a barrier for data sharing. So asking countries to look at their laws, make sure that they really do what is intended, that they aren't perhaps accidentally a little more strict than you really would like, that you can share data, and then making sure that your scientists and researchers and public health also understand what they're allowed to share means that when that day comes, you can do that confidently and quickly without having to convene Parliament.
Great, and I think we're going to have one final question before we release the luncheon.
Sorry, thanks. I'm Anya O'Toole from the University of Edinburgh. I'm going to continue and ask about data sharing. So it's in and around the restricted use, and I think that's a really excellent model that can really help. But adding restricted use policies in, how is that going to actually be enforced in practice? Because there's a trust that you're building there with the users, and so Pathoplexus is one, but any sort of restricted use data, getting permission to actually share that data in the first place is obviously quite challenging. And kind of recently, I've personally encountered a couple of instances where I've been asked to review papers that uses restricted use data in the paper, and getting it to the review stage, I feel like is quite a scary point, right? So do we need to be engaging with journal editors a bit more, or at what point do we actually stop this from happening?
So this is a great question, and I think that there's kind of 3 points here. So first of all, I think that absolutely we need to, first of all, we need to, as we've already kind of talked about, community standards are really important. So helping to educate about when should you use data, and when, if you're really honest with yourself, when are you telling someone else's story, and whether it's restricted use or open, should you be using that data? Do you have representatives of that country on your paper that you're talking to, that are included in your analysis? But when it comes to the enforcement, I think you're absolutely right. We need to talk about the points of where this happened. And as for Pathoplexus, we have been in discussions with a couple of journals to talk about how can we make this easier for you guys? Because of course it's not like journals or reviewers and editors are sitting around with nothing to do. They're always overwhelmed. And so how can we make it so that when they get a paper, they can very easily see, this is where the authors are from, this is where the data is from, these are the data use terms, and is there any discrepancy here? Is this a bunch of scientists from country A that are using all the data from country C, and there seems to be no kind of cross-pollination? How can we make sure that editors see this, that reviewers see this, and that gets flagged? And personally, I think this is something that we should try and make easier, not just if that data is on Pathoplexus. It's about educating more generally, because even if it's open data, as I said, sometimes it's still ethically not appropriate to use that data even when it's open. So we need to build that education, and I do think that we can use tools, technology, seek sets, DOIs to help us do that and make that checking a little bit easier, and then be very clear in journals that we're not going to stand to publish this kind of data. We're going to ask that things be retracted, we're going to ask that authors are included, we're going to ask for this to go away and come back in a more collaborative form. So I think there's work to be done, but I think that there is absolutely no reason why we can't improve this in our community.
Great, and a great last point, I think, for our panel about work to do, but I think direction to travel in. So I think just to close, just to thank all of the panelists for their interventions.